Welcome to Rooted to Thrive, conversations to elevate our humanity. I'm your host, Rochelle Peterson Ansari, Professor P for short. This is your podcast sanctuary for cultivating mindsets and skills to elevate our shared humanity. We're taking a deep dive into practical strategies to evolve as anti-racist, culturally competent, and inclusive individuals and leaders. In each episode, we're bringing you real-world examples and actionable takeaways. We're going to talk about personal growth, fostering connection, and creating positive change that dismantles systemic barriers and creates environments where all of us are valued, empowered, and activate our collective power. This is Rooted to Thrive. It's Rooted to Thrive time again. Thank you, everyone, for joining us on Rooted to Thrive, Conversations that Elevate Our Humanity podcast. I'm your host, Rochelle Peterson Ansari, aka Professor P. And today, we have Mariah Wilson, National Board Certified Health and Wellness Coach. She's specializes in social and emotional coaching, pain management, and chronic illness or chronic conditions. Now, her podcast, Reclaiming Your Health, has been one of my go-to podcasts to learn from Mariah and her guests, but about the many, many ways we thrive mentally, emotionally, and physically. That's only one of the things that she has done that has served as medicine for me. Now, Mariah and I first met at LaSalle University, where I was working in the education department. She was a new student in a post-baccalaureate program. We were fortunate to get to work together. She was part-time in our office, and the rest is history. Now we are 7 years, can you believe it? 7 years later as sister friends, coaching colleagues, and so much more. Mariah, thank you for joining me. How are you doing today?
I'm doing so good. Excited to be here. So honored that you asked me to come.
Oh, yes, excited to have you here. And today you're talking about the Clarity Cure, transforming patient experiences through communication.
Yeah.
So, well, to get started, why don't you just share a little bit about your background with the audience?
Sure, yeah. Well, so currently I am a board certified health and wellness coach. But before all of that, I have about 4 years worth of experience on the clinical side of healthcare. And I was working in dermatology, and I then moved into the coaching space kind of accidentally. I was working in marketing for a company during the COVID times and pandemic, and then with that company, someone suggested, they're like, "Oh, you might be interested in one of our coaching roles. I think you might be a good fit." Tried it out, ended up loving it. So that's where I got started with social emotional coaching. That was about 3.5 years ago. So from there, I just kind of developed and really leaned into the coaching space. So while I worked with social emotional coaching of school age children, I have been in different spaces now, whether that was physical therapy and pain management. And now I'm more working in the gut health space, helping people overcome or improve their digestive health and beyond that. Really, coaching is all lifestyle. So, I mean, I guess for those that don't know, because health coaching is not new, but it's newer, and a lot of people don't know about it. It just means that you're an expert in helping people reach their health goals using both evidence-based and holistic practices to help you develop the skills and behaviors to reach your goals.
Excellent, excellent, excellent. And so today we are talking about transforming patient experiences. You've had quite a few, and I'm sure, everybody's listening, you, myself, we've all been patients, right? And we've had experiences that might we might say, yeah, some transformation needs to happen here.
Mhm.
Yes.
Absolutely.
Yes, exactly. And so my question for you is, how does transforming communication in patient or client or member care relate to elevating our humanity?
Oh, yes. I think that, especially from a patient perspective,
Mhm.
because like you said, we all have been that at some point. Those are what stick out to us. I mean, and even as a coach now, working with other healthcare professionals and oftentimes bridging that gap of following what the doctor said, they'll say, like, okay, you have this condition, you need to make these lifestyle changes. And I'm the person that steps in and help them make those lifestyle changes. But when I'm talking with people and they're talking about their communication or what the doctor said, they just like, I don't know how to do this. They said to do this, and they gave me some handouts, and that was
Mhm.
it. And I'm not blaming the doctors or medical professionals because I think there's a lot on them, and there's just a gap there sometimes. But I think a lot of people get lost in that gap. They get told really quickly what to do, what the issue is, and their options, and then it's moved on and there's no more support or communication on that. So whether
Right.
it is helping the professionals that are doing the diagnosing to kind of direct them on how to get that support, or other measures taking throughout the healthcare system, to offer that, whether it's better marketing or more education for people, that just makes such a big difference between the diagnosis and improvement in their journey and the progress that we can see versus just seeing a bunch of non-compliant is, I think, the term that a lot of healthcare professionals will use, but I think it can improve that significantly.
Yeah, yeah, yeah. And I get that. Like, the first thing that popped into my mind was my diagnosis day.
Mhm.
um, when I received a diagnosis of a chronic illness, but then it was managed or even reversible with diet and exercise. And I was just given kind of this blunt information and was told with the doctor that I still go to and had gone to for for a couple of decades now.
Yeah.
Um, but I felt I was feeling something that I thought maybe the doctor is not understanding, right? Like, because I was in shock. Like,
Yeah.
how did I get here? And I felt a little dismissed because it was kind of like, well, you have a history in your family, but it was like, yeah, but I don't even live in the household with those people.
Right.
Like, how would I know what to do? And what filled in the gap for me was a nurse that specialized in that chronic illness, gave me a lot of information, which I know is not always the role of a coach,
Hmm.
right?
Hmm.
Because the person standing in the gap is actually trying to help you with your goals in a way that is specific to you, right? Like to help you get to move to action, they have to work with you
Yeah.
specifically and what motivates you. But I'll tell you that information lit the fire under me, right? Because I am an information person too. So it helped me understand what was going on in my body, the choices I was making that I might have not been conscious of in the past.
Mhm.
And I then later got a nutritional coach, right? A coach for the nutrition piece who was also powerful, right? And understanding human behavior, you could tell the difference,
Yeah.
right? And you would think your family doctors, understand human behavior. However, for whatever reasons, pressure, et cetera, the number of people they need to see in a day, you walk away feeling like something's missing.
Yeah. Absolutely. Absolutely. And that highlights such a great point. Like, the feelings are there even in that initial diagnosis.
Mhm,
And when you're having that conversation with your doctor or medical practitioner that's
mhm,
doing that. And unfortunately, that's a common feeling with people feeling dismissed. So I do think that there is room for, while the doctors and all the practitioners, nurse practitioners, physician assistants, or associates, all of them could, maybe there be some growth in taking a moment, even if it's just one moment, to address how the patient is feeling about what was just told, to let it help a
mhm.
little bit. That's growth. But then also bridging the gap with these other roles between nursing and coaching to help support, people through these bits. And because the feelings, they matter so much more than I think they get credit for. And I
Mhm.
think it's because, I mean, for lots of reasons, it's not about the feelings, but what we've come to learn. I say we, like, as in coaching practices and scientists, whatever, a lot of professional spaces, is that when you understand human behavior, if the feelings are so big that they can't hear anything else, and if you're talking to somebody that maybe doesn't thrive off of getting a bunch of information, there is no progress. There are no
Mhm.
steps taken because they never address the feeling. They never got help or support addressing the feeling. So I'm like, that's why addressing them and acknowledging can be so key in helping people make those lifestyle changes.
Right. So, like, the bottom line is it renders going to the doctor a moot point if
Yeah.
they're not going to make any change. But it could be that in that communication, like the healthcare professional actually has a pivotal role in communicating in such a way that the person will hear them.
Hmm.
Yes. Okay. Good stuff. Now, do you have a personal experience or personal experiences that have shaped your approach?
Yes. Oh,
Mhm.
absolutely. I think the one of the biggest ones that sticks out to me, as of late, has been my birthing experience. Um, it was a few years ago, but I ended up having an emergency C-section. And one of the most challenging parts of that experience was not me was me overcoming the emotional toll that that experience took. And I was so shocking to me because I was had heard and was kind of prepped about the physical, toll that a C-section can take on you, especially when it wasn't like a scheduled one, a planned one, or anything like that. But, and not that that wasn't challenging. However, the emotional toll was still something I think about and have to work through sometimes because
Mhm.
of how I was interacted with by the staff that day. And
Mhm.
I think, like, to make a long story short about all how that all came to be, like, the surgeon ended up calling me the day of I was supposed to go in. I had some tests done the day prior, and they had told me, go home, wait till you go into labor. The following day, the surgeon calls me. He's like, you need to come in, to have a C-section. And I was so confused because I was just there not even 24 hours ago, and they were telling me I was fine. And I'm like, okay, but explain to me why this change, why this change, why this change. And it wasn't really a clear answer, at least from my perspective. There was no clear answer. Nothing more, nothing new had developed from the day before.
Mhm.
But anyway,
Mhm.
I did end up going in to make sure I was okay, baby was okay. But even from that call to the time that I went to the hospital and had my first interaction with a nurse, it felt like the energy was just that I was this inconvenience. And
Mhm.
that lasted throughout, from through delivery, as well. And that was so shocking to me to feel it from the doctor, the nurses, not all of the nurses, won't say that was everybody, but the energy was strong enough for me to, feel it and remember it and it be a big deal to me. And the thing is, it made it so, it was such an ironic experience, I thought, because the day that that was happening, my son's birthday, it just happened to fall in the Black Maternal Health Week, which,
Mhm.
for people that don't know, there's Black Maternal Health Week because Black women are disproportionately more likely to die either during childbirth or during a pregnancy related complication. And of course, this happens to other women and other groups of people as well, but it's disproportionately higher in Black women, so much so they have a national week during it. So it felt so ironic that a week where we're supposed to be more attentive to the Black women disparities, not that I was expecting like special treatment or anything, I just expected love, decent care as anyone should, regardless of your race, gender, identity, whatever.
Mhm.
Um, I just thought that that was so ironic that during that week I felt so dismissed, so
Mm.
like I was almost to the point where I was like, do y'all want me to come back tomorrow? Like we can try again another day. Like I just
Wow.
that is one of the biggest things. And that experience made me feel like more than ever, even though I had already kind of felt like this, but more than ever, it was just really highlighted that there is such a need for education and more training in the healthcare field about emotional regulation and better communication skills. Because while we do know that a lot of healthcare workers, they're skilled, they're knowledgeable, they are very educated, they're overworked, they're burned out, they're stressed, and some patients treat them absolutely horribly, to be honest. And all of those can be true and real, but if it gets in the way of how you walk into a room and treat a patient, on top of whatever biases, it's just that's not acceptable.
Right.
So that experience really made it stick a little bit closer to home for me, because I'm like, man, I feel like I understand like some level of stress and all these things that these people are going through to a degree, and I haven't done anything to be feeling this way.
Right, right, like you're an inconvenience, like, you should never feel that way in
Yeah,
that situation, right? Like, as a patient, period.
yeah,
Yeah,
yes.
that's interesting. Gosh, wow. And so, yes, you've called this, a lack of quality communication.
Mhm.
And like you mentioned, there might be a variety of reasons, time constraints. Hey, somebody could have just cussed that person out.
Right.
And then, right. But I mean, but when it's multiple people, you have to wonder,
Exactly.
right?
Exactly. I'm like, this
Right,
is the culture here,
right.
or at least this is the culture today.
Right, exactly. And that one time that you were there to have your child,
Yeah.
you don't get another chance,
No. No, you
right?
don't. Mhm.
Yeah, and this may or may not have been the case during, that example that you gave, but you mentioned that the lack of quality communication can also come from biases and assumptions. And you've mentioned that it could be lack of education as well. I was curious if you could talk a little bit about the biases and assumptions we need to tackle. Like, what do these biases and assumptions potentially look like, right? How does it
Oh,
translate into behavior?
right, absolutely. Well,
Mhm,
sometimes it could look like an age thing.
mhm,
There's people that will speak to me, or if they feel like, it doesn't have to necessarily be me or other, it could be
mhm,
somebody else, whether they're older or younger, they assume one thing about them. So I've had people tell me, you and your generation, you
mhm,
guys just don't communicate well, or you don't do this, other thing. And I understand that that's a generalization, but at the same time, that's a generalization. You're not talking to the general population. You're talking to
right,
one person right now.
mhm,
So it could look like, oh, this person is part of this generation, and that means that they don't do X, Y, and Z. And that happens that's called being ageist, by the way.
mhm,
But, that's
mhm,
could happen on the younger end, older end. It happens to all
mhm,
ages, middle spectrum of age. But
mhm,
that's one way too. And then just even understanding that, I mean, I guess another example would be, but race is a big one, because
mhm,
like where I gave birth is a predominantly white area, which is fine. It's just that I'm like, okay, we might have to work a little bit more to make sure we're on the same page. There's not that, not like maybe some understood
Mhm.
um, nuance to our situation. There's more communication that may needs to happen. And then the fact, I felt like I was just being treated like how they would ask some of the questions in that birthing experience was
Mhm.
more like, okay, what now? What's the issue? Like, why do you keep asking me questions? And that put me on the defense because I'm like, why are they treating me like I'm being this defensive, aggressive person, which is a big stigma with Black women. And so
Mhm.
instead of me being able to be present and focus on what was going on, I'm wondering, are they asking me this because of the color of my skin or because of what's medically presenting right now? And
Mhm.
I'm like, I'm the patient right here and having to do so much advocating, and I feel like I'm being interpreted as the aggressive Black
Mhm.
woman. And I'm like,
Mhm.
I walked into this energy of you guys being like, well, like I was bothering them.
Mhm. Exactly. And it's interesting, like you said, the energy was more like, why are you asking questions? I felt that as well. So let me just tell you, I have a mother who would not care. She gonna ask you those questions,
Yeah.
right? And what I've found, what I've experienced is that when especially it seems to often be with the doctor. I've had better experiences with nurses
Mhm.
and other healthcare professionals, but that when we have asked pointed questions that we want answers to, we do get that sense from, get this reaction kind of like, well, why are you questioning me? As if to say, you should accept what I have to say and move on.
Right. Right. That's the exact energy that comes. And it's so interesting because I think these people that should be the most caring for us, and not to say that they don't care, but we feel that energy that they're
Mhm.
giving off. And it's almost
Mhm.
like, you came here for help. This is what I'm saying. But I'm like, you're not, this is not, I'm not an inanimate object. I'm a person and I have experience, which is why I feel like a lot of the concepts from coaching could be useful to be used as education and training for other healthcare professionals, because that's one of the biggest challenges that I feel like coming with
Mm.
is this energy of defensiveness. And so I think sometimes something a patient says or does triggers a healthcare professional, and then they're in the defense and they stand more firm in their authoritative role and
Mm.
expert role. And then they project that, and that puts the patient also now on the defense. And they're just both defending rather than working together, which is against the cause.
Right, there you go. So I hear this sense of the assumption might be on the healthcare professional side, from their perspective, might be that, well, I'm the authority. If they are questioning me, they're doubting me,
Right,
as opposed to they just want to know why. Like, they want to know the answer to their questions to help them make sense of what's.
right. Exactly. Exactly
Mm. Whether you're the patient or a family member of the patient. So,
that.
yeah, the experience I had in my head at the moment was, when my grandmother had a
Mhm.
stroke. And, her children and grandchildren are there. When we're there and the doctor's in the room, we ask questions, right? And I will be the main one. Listen, I irritated my family when I was a kid, because I was always asking why.
Yeah.
you know, and I get that, but we need to understand what's going on. So we need to know, is there something that we can do to intervene? We also need to ask questions in that particular scenario, right? Like how we could, like what to hope for or to look for,
Mhm.
right? Like
Yeah.
those are the reasons why we're asking questions, and we want to be able to advocate for
Right.
this person who can't speak at the
Yes.
time. Yeah.
Yes.
Yes. And so, yeah, I can understand how that would, that comes up regularly as a challenge. So, you mentioned different things that you do in health coaching that healthcare professionals who are not coaches could benefit from.
Hmm.
Please do share. We're looking for some practical ways people can be better at
Yeah.
elevating, maintaining the human dignity of other human beings.
Yes, absolutely. So, one of the biggest things about coaching is coaching presence.
Mm,
And that just is, how you're showing up.
mm,
And that takes emotional regulation.
mm,
And we're under the same pressures, maybe not the same degree. I mean, and that's true even of doctors in different specialties, but my point is that everybody has a time constraint in one way or another. um, we all have different things that we can be doing that need to be going on and stuff, but
mhm,
in the moment that you're with a patient, are you listening? And what's your body language saying to show that you're listening? Are you
mhm,
being empathetic? So just kind of educating people on what that could look like,
mhm,
I feel could be helpful in being more mindful of our presence. And I also with being flexible. Like,
mhm,
yes, you may one of the things that has been transformative to me and how I coach people is just knowing that, like, I forget who said it to me, how they worded it, but they're like, essentially in coaching, like, there are, yes, I'm the expert in behavior change, but
mm.
they're the expert in their own life.
Right.
So while you may be the healthcare professional, educator, expert, doctor, whatever, you're an expert in that area, but you're not an expert in Mariah.
Right.
and
Right.
and again, that's not their role to coach in
Mhm,
that moment, but just kind of recognizing that there is room for growth for even you, in dealing with Mariah can open the door, make a little bit more space
mhm,
for acceptance, for growth, for the relationship to work. Because at the end of the day,
mhm,
it is a relationship. It's a doctor
mhm,
patient relationship. I mean, a lot of places preach that they want patient centered care. And I'm like, okay, but how do we actually get this if people don't know how to be effectively present with their patients without making the
mhm,
patients feel dismissed or diminished, because that's a big thing too. People feel like they're diminished because they don't have the education, even though they're not supposed to. I mean, they are there for the expert level of support. So I think one of the key things that could be helpful is educating more healthcare professionals on how to have a helpful healthcare professional presence versus instead of coaching.
I like that. Uh, Healthcare, did you say helpful? Help
Yeah, I ended healthcare professional presence is what.
present. Yes, a healthcare professional presence. I like that.
Mhm.
Yeah, and the assumptions are what drive it.
Yes.
The assumption is the person is the expert in their lives. They obviously need someone to listen to them.
Hmm.
Yes. And they may have questions.
Yeah.
Right? They may have questions. They don't have your degrees, your expertise, and you are the source of that information for them. And
Right.
and for some, even I'll just say myself, right? For some, I get greater ease by being able to answer the question why,
Right.
right? Like, or to have my questions, whatever they are, answered helps me get regulated myself.
Yeah.
And
And
then I can hear you. Yeah.
yes, then you can hear them.
Yes.
The not taking offense to asking questions, because the question isn't about is insulting their intelligence. I'm asking you because I think you can help me
Right.
in this. But then also the other side, I know, between people's maybe ego is also the big time thing. Like, people do feel like, okay, and doctors and other healthcare practitioners do not have a lot of time to see a lot of patients and maybe spend as much time as they would like to. So, but there's ways to navigate that delicate conversation of the time straight in a respectful way. So I think that includes being able to be a little bit flexible. You might have walked into the room wanting to tell them the diagnosis and every way of how to cope. They may
Mhm.
not be there yet to hear you on how to treat it. I mean, yeah, how to treat it versus cope. So they may be stuck on what it is you're talking about, but you've already moved on to trying to tell them how to treat it. And I'm like,
Mhm.
okay, sometimes it takes a little bit of flexibility and just being there with them and answering those. And then when you see that your time is running up, say, okay, we only have 5 minutes left. I really want to make sure you know this. Let
Mhm.
me give you this, and we can talk more about a few of your questions at our next follow up. Or, there's
Mhm.
ways to do that versus ignoring what they're saying. And that's why we
Right.
get so many people that feel dismissed. And then, or we'll say that piece, we can answer it as they're headed, as we're pushing them out the door, not
Right.
physically, but like essentially, like, okay, I
Mhm.
gotta go, read this pamphlet and good luck and I'll see you next time and I want to know that you did everything I said to do. It
Yes.
doesn't work for
Yes.
a lot of people, but
Yes.
learning how to be flexible and navigate the challenge that you have of time and other restrictions,
Right.
um, learning how to communicate that effectively is also so helpful. And I've learned that as well as a coach, kind of calling out what is there. It's awkward that we may only have
Mhm.
15 minutes, but at the end of the day, we only have 15 minutes. So I can say,
Right.
what are two of your questions that I can answer now? And
Oh,
go
that's
from
very good.
there.
Yeah. Yes, yes, I love it. And you mentioned the time, right? Like making sure people are aware that what time is left.
Yeah.
This helps them because in that space they may not, right? Like they're
Yes.
not conscious. And I have to mention this. I know before I go into like a doctor's office that it, in that circumstance at least that the appointments are usually about 15 minutes. I
Hmm.
know that. But if you tell me something that I wasn't expecting to hear, all that goes out the window.
Right.
Like it just
Right.
not
People don't
conscious anymore. So I'm helped by you telling me the time.
Yes. And then just helping, and then I'm like, that's where they can be the expert again and help them kind of
Mhm.
navigate that. You can't change the time limits, they can't change the time
Correct.
limits. And then, and on the patient side, a lot of people have taking time out of their day with adjusting their schedules, whether it's work or family, or if you're trying to see a specialist, it could take weeks or months to see these doctors. So you feel like I need to get the most out of this right now. So if the healthcare professional or doctor can kind of ease their mind and say, hey, we will continue this conversation, whether
Yeah.
it's through the patient portal where I can send you some resources that'll answer some of these questions and then you can
Mhm.
respond, or we can set up a follow up. I know depending if that's a few weeks or months out, that's comforting or not, but that could be, another part of the conversation. But simply even calling out the time limitations and how they can be addressed is comforting to people.
Yes, yes. So I agree wholeheartedly that those techniques that we do use in coaching would go a long way,
Yeah. Yeah.
very long way. And you mentioned earlier with your body language, right? Like the body language that suggests that you're open and you're still here and present
Yes.
makes a big difference.
Yeah.
Yeah, I wonder what people were expecting in this conversation. I hope they understand, right? Like this is just real, this is basic human behavior
Yeah.
and communication. We're talking about, as you mentioned, you said that, a lot of organizations say they're people-centered or patient-centered.
Mm-hmm.
Yet what happens in practice doesn't align with that.
Nope.
And I don't want anyone to miss that the point is it's about the assumptions that we're making in those spaces, both what the patient or yeah, the patient or client perception and their assumptions, which you can't control, but what you can control is yours.
Yes, exactly.
Yeah.
Exactly.
And I will always say in any space, whether you're educator, healthcare professional, I believe leader in any space that the professional has greater responsibility.
Absolutely. Absolutely. That's which
Yeah.
is why I'm like, a lot of things that aren't your fault aren't the patient's fault either, but you're bringing it into the room with that energy of stress or overwhelm and things. And those are other things that are very valid and need to be addressed. But it also kind of speaks to where you could be more empathetic, because while you have all these feelings and things going on, so does the patient. And you're counting on them to not bring all their baggage from other people and a doctor maybe that wasn't you.
Mhm.
You're
Mhm.
counting on them. So what better way than how to be the example of that? Which is what
Mm.
I try to do in whether I'm coaching a patient or member, or if I've been in a leadership more leadership role and I'm talking to other team members about something and maybe they feel on the defense about something, rather than just try to push past it. That's an opportunity for me to be an example. Okay, they're so stuck on this, how they feel about a situation. Let me
Mhm.
lean into that and empathize. I don't know their exact case and all the ins and outs and nuances. And honestly, I don't really need to know all that, but I can empathize and understand frustration. And
Mhm.
so having that human connected moment can
Mhm.
save you, that can actually save you so much time.
Yeah.
Instead of trying to fight them to get your point across and say what you want to say,
Mhm.
connect for just, it could take less than a minute to connect with somebody by
Mhm.
saying, listening to what they said and gently summarizing or reflecting what you heard. Oh, I see how frustrating that is, or I can hear how invested you are in this. Oh,
Mhm.
saying somebody's name, like, oh my goodness, yes. Like so many people feel like their doctor or professional is a healthcare professional is just disconnected. But like if you add in saying their name in the middle of an appointment or towards the end, they like that just feels more personal,
Mhm.
and more connected, and like I see you and
Mhm.
I can I'm here with you. I
Yes.
just think that's an opportunity for the healthcare professionals to kind of demonstrate what we would like from the patients, because it is a
Mhm.
relationship, and if you want different behavior or changes or them to do what you're saying, build that trust, because that's what it ultimately is, trust, by showing that like you can emotionally regulate by doing that.
Mhm.
And a lot of times people will lower their guard and learn to do that themselves.
Yes, 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 yes. And we've seen that over and over again in the coaching space. Like, my in my training, and it sounds like similar to yours, that we are trained that your client, your member, that person will show up the way you show up.
Yeah.
Yeah.
Mhm.
Yeah. And we know that most medical professionals do understand that, right? Like there has to be some class on that. It has to be some class.
Something.
that helps people understand how humans respond, right, to our presence, our energy that we
Mhm.
bring to the space. And now, well, Rooted to Thrive, we're talking about being anti-racist, culturally competent, and inclusive. And you touched on this a little bit in your story, right, about your personal experience. Black women having a very high, a disproportionate rate of death during pregnancy related when they have pregnancy related issues, right? Like so in childbirth and in other situations. I just wanted to round out our conversation about the importance of our cultural competence, or at least the connection, right? Like
Mhm.
to this communication, this way we provide more quality healthcare to people. How can we connect that directly to being more anti-racist or culturally competent or inclusive or all of the above?
Yeah. I mean, by focusing on how you're communicating, especially because a lot of the issues with communication are rooted in biases and assumptions and things like that. So that to work against that is, I would say, to embrace some of these coaching qualities, because I think, like, one of the biggest things with coaching is with your presence, and it really is getting you out the way to kind
Right.
of
There
sum
you
it
go.
up. You're getting yourself out of the way so that you can see the person in front of you. So if that is the practice, you're going to do that regardless of what the person looks like, acts
Mm.
like, how they identify, which is going to make you a more inclusive person, because you're not letting those biases and assumptions um, get
Yeah.
in the way of that. So and we do that by, yes, maybe working on our presence. I think asking better questions as well, what
Mhm.
practicing more open-ended questions, and not to say that closed-ended questions where you're just answering yes or no aren't helpful and there's not a time
Mhm.
for them, but sometimes the one or two open-ended questions will tell you so much more about a person than, five closed-ended questions. And
Mm.
that leaves less room for you to fill in their narrative. It gets you out the way. And I think by being curious of people is going to help you be more inclusive. And
Mhm.
um, even if you challenge yourself to empower people in general, but like empowering can look like so many ways. So many people feel dismissed or diminished, especially in minority communities. But if
Mhm.
you make it a point to call out something positive about a person that you've noticed and how that could pertain to what you're talking about, that would do leaps and bounds. So
Yes.
I think that making these communication adjustments, how can you not be more of an inclusive person by
Mhm.
influencing this or
Yeah.
in incorporating this?
Right, right. How could you not? I love it. This has been a wonderful conversation. Now, do you have, well, that is some great final advice,
Mhm.
right, on how to be more inclusive. It does raise your cultural competence when you are curious, right? And that's language we use in the coaching space, right? Be curious about people and always asking the question of yourself, right? Like, what is this person really trying to tell me,
Right.
right? Like, what's the goal beneath the goal?
Right. And this,
Hmm.
with a lot of like medical professionals, they're very, sometimes the doctors or the highly educated can be kind of hard on themselves and don't want to show that vulnerability of not knowing. So we
Mm.
shy away from it. But when it comes to building a relationship, that's how you build it, by build, like, so mastering where to be vulnerable or open, simply open.
Hmm.
So when somebody says something, you can call out what you hear,
Hmm.
and then give them the opportunity to either, I would say, either confirm what you said or clarify what they were
Mm.
saying. And that's
Mm.
all that is. So be
Mhm.
gracious to yourself as you learn people, and are open to them or welcome them to share a little bit more. And then, if they correct, it's not correcting you, it's clarifying what they say about themselves and what's going
Mm.
on for them. So try not to take it so personally, but as a moment to strengthen the bond.
I like that. I like that. Yeah. And I keep thinking, so I just want to say this out loud. I keep thinking about the fact that many professionals in healthcare are trained to see patterns, right?
Yeah.
So, right. And I don't think we're asking people to unlearn it, but that's what these requests are pushing up against,
Yeah.
right? Like some training that makes you look for patterns. And we're saying, hey, when it comes to that breathing, that, living, breathing human being in front of you, some of that has to be countered in order for this relationship to be one that's healthy, reciprocal, and a quality interaction,
Yes.
positive quality interaction. Yeah.
Yeah, absolutely.
So I feel for the healthcare professional because they have to unlearn something,
Yeah,
right?
absolutely.
Yeah.
Absolutely. And then I know that there are definitely some people, they don't want all the questions. They don't have a lot of questions. They just want you to tell them what to do, keep it as simple. They're like, and that's why it's helpful to put that feeler open-ended question out. One or two really is all it takes. And
Mhm.
people will either confirm or they'll clarify. They'll say, I just want you to tell me what to do. That's
Right.
your cue to just go ahead and be that more directive person with
Right.
them, but really directive and authoritative isn't a one size fit all. That doesn't work for a lot of people, especially more minority groups where we've been put on edge for a lot of reasons,
Mhm.
history and everything with healthcare. So that way, that's a guide for you. Let the person tell you what they want,
Mhm.
because most times they will, and whether they say it directly or their body language or their storytelling or how they keep asking questions will tell you. You just have to be a good listener.
Yeah, yeah, yeah. That is powerful information. Are there any resources that you would recommend for our listeners for their further learning? Anything that you might share with us before we go?
Yeah, there was this
Mhm.
one book that I read. It was actually part of my health coaching training, but I think it could be so helpful because since one of the things we've talked about is questions and
Mhm.
the different scenarios and things like that. But it's called Motivational Interviewing,
Oh,
Helping
yeah.
People Change and Grow. It's very popular in the coaching community, but
Mhm.
I think that the concepts taught here, and they give so many examples,
Mhm.
if followed, they will naturally increase what you can learn so that you'll be a more culturally competent and inclusive professional.
That's powerful. So, motivational interviewing is something that youth workers, people in the, nonprofit youth work, youth development space do. As an educator, I'm familiar with it as well, someone who's a professional educator, right?
Yeah.
Um, so it's interesting that there would be a book called, for motivational interviewing, period, for healthcare, that healthcare professionals could learn from. Yeah, see, I see the through line. I
Yeah.
see the through line. When you're dealing with human beings, really all of these artificial barriers that we put between disciplines don't matter.
Right. It doesn't matter. It doesn't.
Yeah. Right? We need to learn how to be better at one, hacking our biases,
Yeah.
being present, listening, building relationship
Yeah.
where many of us may not have. I think we have been taught to center relationship, we just haven't been taught how.
Yes.
Yeah.
Yeah.
Well, Mariah, this has been wonderful. You have been so generous with your time, your expertise. How can people find you after this episode?
Yeah. I think the best place would probably be my YouTube at this point.
Okay.
Um, it, I'll that has my most recent stuff up there, but I have my podcast, Reclaim Your Health. And so there's plenty of information up there, and I still interact up there. So if there's anything new, I'd put it up there. So the YouTube, you could just look at Reclaim Your Health podcast and it'll come up.
Excellent. 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 And we'll have anything else, like if there's a LinkedIn or anything other than that, we'll have in the show notes.
Sounds good.
Yes, so
Yeah.
that you can connect there as well. I want to thank everyone who stopped by. Please leave a comment, share this episode, and definitely subscribe so that you are alerted to the next episode or any updates that we have on Rooted to Thrive. Thank you all again for listening to Rooted to Thrive.